With at least 246 suspected cases and 80 suspected deaths, a deadly Ebola outbreak has gripped Democratic Republic of Congo for the 17th time now. Neighboring Uganda has been impacted as well. The World Health Organization has now stepped in and declared this a public health emergency of international concern. In a country gripped by conflict, the local authorities have been scrambling to contain the latest outbreak involving the Bundibugyo strain of Ebola that dates back to April. As per reports, the earliest known victim developed symptoms on the 24th of April and died 3 days later. While a majority of the cases in the Democratic Republic of Congo are concentrated in areas of the Ituri province, such as Bunia, cases have been confirmed in the capital Kinshasa as well as the Goma city, which is controlled by the M23 rebel group. The virus has spread into Uganda as well, which has reported 2 confirmed cases, including 1 death so far. And amid this, experts have criticized the delay in detection of this outbreak.
The risk is very high that the next pandemic will start from the DRC. There is a strong chance this will happen because our ecosystem is favorable to the development of various pathogens. But the problem, as I told you, is the weakness of surveillance. Our system is very weak at detecting an outbreak.
A highly contagious and fatal disease, Ebola was first detected in the Democratic Republic of Congo way back in 1976. 6 strains, including Sudan and Ebola Zaire, have been identified. Over 15,000 deaths have been attributed to this very disease so far. Now, why is this disease so dangerous? It has an average case fatality rate of around 50%. Associated with fruit bats, it spreads via animal to human transmission. Infected humans then pass on the disease to others through fluids such as vomit, blood, and semen. And this is not all. Direct contact with the last remains of the deceased Ebola patients has been a major transmitter of the virus as well. On an average, people begin showing Ebola symptoms 8 to 10 days after exposure. Initially, the symptoms are generic, such as fever, weakness, muscle pain, headaches, and sore throat. This is followed by loss of appetite, nausea, vomiting, and diarrhea in severe cases. Internal and external bleeding has also been seen. Now, as authorities and aid agencies have intensified efforts to contain the outbreak, Democratic Republic of Congo has established new treatment centers where patients are being treated free of cost. The last Ebola disease outbreak in DRC lasted from 4th of September till the 1st of December last year, with a total of 64 cases, including 45 deaths.
The sooner we take the patient in for care, the sooner we treat them, the sooner we will stop the movement, what we call the spread of the virus. So this is not a mystical disease. Make yourself known so that you can be taken care of and so that we can prevent the disease from spreading. That is really the message. Treatment is free. Come and get treated.
Now, the deadliest Ebola outbreak was seen in West Africa. While the epidemic was first reported in Guinea in December 2013, it soon spread to countries like Liberia, Nigeria, and Sierra Leone. By the time the epidemic was declared over in June 2016, more than 11,000 deaths had been recorded. The current outbreak is potentially more challenging to contain because the currently licensed vaccines protect people from infection with Ebola Zaire only. And at present, 2 vaccines to combat the Sudan strain are undergoing clinical trials. Supportive care measures for Ebola disease include rehydration and blood transfusions. Already, the WHO has rushed a team of 35 experts and 7 tons of emergency medical supplies to the impacted areas. While it has advised both affected nations to undertake several measures such as cross-border screening, travel restrictions for patients and their contacts, it is yet to designate this outbreak as a pandemic. No other country has been advised to close its borders yet or place restrictions on trade and travel as of now.